My name is Sarah, and I work at Entropy Physiotherapy and Wellness in Chicago, Illinois. And our today's Asking for a Friend question is about doing crunches or sit-ups when you have a diastasis rectus or diastasis rectus abdominis or diastasis recti, or you just notice you have kind of that gully in your abdominal muscles. They've pulled apart a little bit. Now, this is something that can happen. It happens very commonly in pregnancy. Some people say 100%. We don't know that that's true. Some people will notice it actually in gentlemen, and actually newborn babies will sometimes have them. So it's not just from pregnancy, but that is where we see it most commonly. So that being said, are crunches bad for that? There is no evidence that I can find that says doing crunches will make it worse. In fact, a recent study last year by Diane Lee and Paul Hodges say that actually doing crunches helps tension that area, which is really what we need for our bodies to work better. And on that note, so it's important to have some stability in our spines. However, some of the other advice I see, other than avoiding crunches, is to brace your abdominal muscles and don't move your back. This is also not supported by the evidence, and actually doing it will just, I think, make life a little bit more difficult. We have no evidence that bending and moving will make a diastasis worse. It did take 9 months of a person growing inside of you to, in most cases, to make this happen. So that's a lot of force over a sustained period of time. And simply doing a twist is not going to make that worse. Now, as far as having it resolve, so a lot of new moms, their primary concern is getting back to being themselves with the new role of mother. So when should people start working out? What should they be doing and not doing? My primary suggestion for women is to go do things that you love, and that if you're concerned, talk to your doctor and talk to a physical therapist. As a physical therapist, if a woman comes in with concern about her diastasis, I ask her one question. Well, lots of questions, but the biggest one is, are you more concerned with aesthetics or function, or possibly both? So if it's primarily appearance, we can take a look at when she's not happy with that and look at just if we can make her happy with changing her postures, getting her back into an exercise program. There's a lot of ways to go about that. And if there's function or issues with function, we look at that. So what is she having trouble with? I have had more women come in and see me for just one visit. Not that I could resolve their diastasis in one visit, but really, truly, I gave them just essentially permission and the confidence to go and do their exercises, feel like they were helping themselves, and getting back to feeling like them. So again, we have no evidence that says crunches are bad for a diastasis recti, and that actually we're getting some evidence that says it might actually help with lumbar stability and general function. And moving your spine is good. That's why we have so many bones in there. It's meant to move in a lot of directions. And moving any of those directions is not going to make anything worse. Thanks.